Okay, we'll get, while Deborah is getting that up and running, I will, there we go. And then if you can get it to,
What do I need to do here? Show taskbar, is that how you did it?
I think it was. I think you click on the half screen on the bottom under the, yeah, that one.
I don't know, it blocked out because I had the two screens going here and now it blocked out the one and I can't see anything. Let me stop sharing and try again.
Okay. Try to open it. In the meantime, I'll start the meeting. Hi, everyone. Welcome. I'm Elin Dowd, although Deborah looks a lot like me. We share a Zoom account, so that's actually my face over there as well. But I am the real Elin Dowd. And I want to welcome you all to our benefit clerk training this morning, but more importantly, welcome you to the consortium. We have one current member with us from the town of Lansing. So welcome to you as well, but you are here with our new members who will become effective January 1st. So there will be part of this presentation that's geared specifically towards the new members, but there is a lot of stuff that is geared towards the entire consortium and very beneficial, we hear from our previous participants. So I would like to first have, since we're all together for the first time, and if you can show us your face, please do. You don't have to stay that way the whole time, but we'll go around and we'll make introductions so we know who is with us, since we're a much smaller group. So as I said, I'm Elin. I will turn it, I'm gonna go around the circle so you're not all at once. Jessica, you want to introduce yourself? Up, you're on mute.
I had to find that button. I'm Jessica Hobart, principal account clerk for the consortium. Currently, I still work over at the Tompkins County office building. So that's where you'll find me someday if you can stop in. Quite a few before have, but maybe someday we'll be back to that. But I'm the one who you will be receiving lots of emails from about your invoices and your employee rosters.
Great, thank you, Jessica. Then we will go to Jody from Lansing.
Hi, I'm the clerk treasurer for the Village of Lansing. I'm the one, we've been with the consortium for what, about a year now, maybe 2. So
Great, welcome. All right, Beth, did you actually take yourself off mute?
Yes, I did.
All right, Beth.
Hi, everyone. My name is Beth Miller. I'm with Excelis Blue Cross Blue Shield. I'm the account manager with the consortium. And I'm excited that you're here and you'll be part of Excelis and the consortium.
Great. Terry?
Hi, I'm Terry Godfrey McPherson. You'll see both names. I work very closely with Beth. I'm the account service consultant. You can contact me at any time with questions, concerns, or any needs that you may have, and we're excited to work with you this year.
Great. Our Dean?
Easy cheese sauce. And my favorite ingredient is, don't tell nobody, evaporated milk.
Our Dean? Oh, there you are.
Hi, I'm our Dean Tiffany. I'm with the town of Tyler. I'm the bookkeeper. And we're new to the consortium this year.
Great. Welcome.
Thank you.
All right, Janine.
Hi, I'm Janine Bond. I'm the bookkeeper and human resource officer for the town of Hector. I've Been here 15 years. I'm really looking forward to making this change and being in the consortium.
Great. Welcome.
Thank you.
Corey?
Hi, everyone. I'm Corey Prayshaw. I actually work for ProAct. So like Excelis, but I handle the pharmacy side of things and looking forward to working with all of you.
Great. Jason, nice to see you today, Jason.
Hi, everyone. Jason Warshaw with Excelis, Wellbeing Consultant. Look forward to hopefully meeting some of you in the future live from my garage, but nice to meet everyone.
Eric?
Hi there, Eric Kohler from Excelis. I work with Beth and Terry. I oversee the enrollment operations, also known as membership and billing aspects.
And Rob Spinard?
Good morning, I'm Rob Spinard. I apologize, I'm a little under the weather this morning, so I apologize for my voice. I work for Losi and Cahill, and we are the plan consultant to the consortium.
And like Excelis have been with us since day one.
Yep.
We're not
That's
Rob. I don't think Rob was at.
I have not. Losi and Cahill has. I have been with the consortium for roughly 2 years now.
Yeah, he came on board around the same time I did.
Yep.
Great. All right, let's see. Tiffany.
With the American cheese, and it's silky, so this is not even a triple play, Rachel. This is a quadruple play. If there are over 4 outs.
Nope. I guess Tiffany is not joining us. Tiffany, are you there? Okay, we'll go to Diane.
Hi, Diane Seidel. I am the town clerk for the town of Catherine. I will be the contact person here with the consortium for our members.
Great, welcome. I'm actually in Watkins Glen, so we're kind of neighbors. And Cindy. Cindy, if you're talking, you're still on mute. Maybe Cindy's with Tiffany. Tiffany, are you back? Okay, so I think we have everyone that's actually currently present. We'll have Deborah running the slideshow. So anyway, again, I'd like to welcome you all to our annual benefit clerk meeting. We have, I think this is the 3rd year now we have done these meetings, and they are an opportunity for us to learn what's new, usually for the next year, and to launch our open enrollment period. Kind of unique this year for us to all do it on Zoom, but it has meant we've had greater participation because people don't have to commute very far to participate. So we're glad that everybody could join us. Quick update for those of you who weren't in the meetings with Don Barber. The consortium is your insurance plan. So we came together 10 years ago as a shared service under 5G, and then we're certified under Article 47 to be a self-funded insurance company to meet the needs and provide affordable health care to local municipalities. We started with about 13 members, maybe 13 members in Tompkins County, and we have grown to 7 counties. We're growing to even more counties, and we are now up to 47 members. So we're really excited about the growth that we have had. And I'm excited because a year and a half ago, I joined the consortium as the first full-time paid staff member. We did have people like Losi and Cahill as consultants helping run the consortium, Don Barber, who you met probably through the application process, and Michelle Coco, who you'll meet later, working as a part-time consultant. But now we actually have a staff. Deborah Meeker and I are in the headquarters office, and Michelle Coco works part-time over from Tompkins County. So we're happy that we're growing and that we have this core now to be able to provide you with services. So let me get the first thing out of the way. Who are Excelis and who are ProAct? In the past, most of you, I think all of you, purchased your insurance straight from Excelis. So Excelis was the insurance company. They took on all the risk, they paid your claims, and you used their provider network. And they probably were your prescription drug plan as well. For us, ProAct is the prescription drug plan, and Excelis is just the network provider and adjudicates our claims. So they are, ProAct and Excelis are our third-party benefits administrators. And that's a little bit different twist from what you have been used to in the past. It means that the consortium is also here to help you with all of your health insurance needs, so you can count on us as well. I have had new members in the past say, I just missed my broker. My broker did everything for me. We're not a broker, but we are happy to do everything for you as well. So don't hesitate to call Deborah or myself with any of the questions that you have going forward. And part of this presentation will be how to contact ProAct and when to contact ProAct and when to contact Excelis with your other questions. But you will know Beth Miller and you'll know Terry Godfrey and you'll know Corey Prashaw, because they are very much a part of the consortium and are part of getting us the services we need when we need them. So this morning we will, let me back up 1 second. Judy Drake, the chairman of the board, was supposed to join us this morning. She is the head of HR for Town of Ithaca and is the director, the Town of Ithaca director. Judy, unfortunately, I'm not quite sure what she got called into this morning. She may be managing a flu clinic or something, I'm not sure. She was unable to join us and welcome you. So on behalf of Judy, the chairman of the board, I welcome you as well. And you'll see more of Judy at our board meetings and other committee meetings. So with that said, this morning, we will cover, I think you've received a copy of the agenda, but we'll go through at the beginning, we'll have Jessica cover consortium, accounting, plan changes, website, where all this information is found. We will then jump to ProAct, have Corey talk to us about any updates from there and customer service. Then Excelis, we'll talk about account and member services. We'll hear from various members of their team. We have moved wellness to the end, and we kind of mixed up the agenda a little bit. So most of the consortium stuff will all be at the beginning, and we've moved wellness to the end. So you'll hear from us, ProAct, Excelis, and then we can answer questions along the way, or we'll leave time at the end for that as well. Next slide. All right. Everything you need is going to be on our website. Okay, that's an exaggeration, but majority of the information you need is found on our website. And we are going to go through our website this morning, and I will reference things and show you the website as we move along. But first, I'm going to turn the reins over to Jessica, who I think is doing about 3 different jobs today. And so we want to make sure we get Jessica while we can. She does have responsibilities with Tompkins County, and we contract with Tompkins County to be our finance arm. And Jessica Hobart is part of the Rick Snyder and Drew Brahman team, and the 3 of them support the consortium's finance and accounting arm. So I'm going to turn it over to Jessica to walk through that piece, because Jessica is who you are going to see every month in and month out, because she's the one who's going to take your money and send you the bills to collect them accordingly. So with that, I turn it over to Jessica.
So hi everyone. I'm just gonna get on here and try to share my screen, but not all the payroll stuff I'm working on. So one second, there we go. Okay, let's start with that.
While Jessica is getting ready, both Tiffany and Cindy do not have a microphone. So they are using our chat feature. And I'm gonna have to close the screen because I can't get the chat feature up right now. Tiffany is the deputy town clerk Tiffany, you're gonna have to remind me which town you're with. Cindy is the deputy town clerk with the village of Owego. So we welcome Tiffany and Cindy. Of course, I could have figured that out. Tiffany is with Tioga, town of Tioga. So welcome to both of you. And don't hesitate to use the chat feature for any questions, or feel free to raise your hand and barge in. All right, Jessica.
Okay, so starting out, just this quick little PowerPoint. These 4 pages I have here are pretty much what you're gonna see from me. The first being, I have it out of order, will be you're gonna get an email that looks like this with your invoice attached. So then, and I'll go into what exactly on these in just a minute, but just an introduction. Then your invoice will look similar to this. And then I will send along what is called the Excelis roster. And this is what I use. They come from Excelis, and I use this to actually create your invoice. So then on the roster, it's going to list each of your members and whether they are single or family right here. And then again at the bottom. So the contract type 1 is always a single policy. And then anything 2 through 5 is family, depending on what type it is. So let me get rid of this and open up. So the first thing you'll see from me come in is going to be an email like this. This one says amount due because they've already paid it. So if you double click into the attachment, that's where your actual invoice is going to come in. Now, a few things you're going to want to check. I make mistakes. I, get numbers backwards sometimes. So make sure when you get these invoices, separate email, I'll be sending the roster to you from Excelis, the actual what I use. So if you go through this, the second page, if you have any adjustments, they're going to be listed separate here. And then we'll go on to the active members for the month, which everyone is billed a month ahead. So here again, it lists your members and what contract type. At the bottom, it gives me the summary. So when we look at this compared to the invoice, you have the contract type 1 single 11. So look at the invoice, and I've billed the single 11. I'm not sure if that's very big here. And then there's going to be 20 of the family. So you go back to the invoice again, and there's 20 family. So I always bill like that for the current month. If there's going to be adjustments, they'll be here at the bottom separate. So then you can go back to the roster, see who they're for, and for what months. So again, they're back at the top. So here we have
Jessica, your slides aren't moving. We're just looking at the roster.
Oh, why does it say it's paused? Okay. Oh, Okay, can you see it now? Hold on, let me. Get rid of this. Okay. Okay, can you see now it's the roster and I'm switching to the invoice?
Yes.
Sharing, okay. So again, looking back at the roster with the retroactive adjustments, because you're billed a month ahead, you'll always have an extra month of adjustment. So here you can see it's July and August, but then I also add September because being billed a month ahead, you've already paid for September. So when you're looking at the adjustments, they can come through a little funny. And of course you can send me emails, call me with questions on that, because again, I can mess these up and sometimes, it can get confusing. So here's the single. So we've got a July, August, September. We've got an August and a September and a July, August, September here. And then I go back through and I do the family. So in August, September, and that would be somebody who came on because it's in addition. These amounts on the roster, and I think I'm going to do this differently next year. Right now I send the whole thing. So depending, you might see this come through, you might not. I'm gonna think it through. This bill where it says current billing from Excelis, the consortium pays this. So if you see this come through on your roster, please do not pay this. Not to us or Excelis. So, but again, I think I'm gonna do it different next year where I just start with this second page so that there's no confusion. I did not open our website, but I wanted to go to our website and show you a little bit of what's available out there. So the part that I use a lot, and you will too for sending things to me, would be the municipal resources and online enrollment. I'm not sure, Elin, is everyone coming on new? Are a lot of them sending enrollment to me?
Yep.
Okay. So, yeah, you will be using this. They're probably not out here yet, but each.
We're still on the retroactive adjustment screen.
What is, Okay, close it maybe. Yeah, it keeps wanting to stop sharing. So let me try again here. Okay, now are we on the website?
Yep, you can see that now.
Okay, so again, I went to municipal resources and down to online enrollment. And this is where you're gonna find a lot of information. Here is the form for if you have a family plan, you'll wanna do the dependent eligibility verification. And then down below, you'll find the enrollment forms for each town or village. Yours currently probably aren't up yet, but they will be. So I'm just gonna pick one for today. And if you've been working with Excelis, you've probably seen these. So first section here, of course, is the signature of your group administrator. What else is really important here is if they're coming on as an active employee or if they're leaving, and then why they're leaving. The other two things that I have to have, or I'll email you back, the effective date that you want the policy to start, and then their hire date. And then second section, what's important, of course, is if you have more than one plan, which plan they're going on, and then if it's going to be a single or family. course, section 3 is again choosing if they're a new hire or why they're coming on the coverage. Section 4 is all their subscriber information. Section 5, I get blank a lot, but it's actually important, and it will not let me put your policy through on the website without this information. So if it's a no, they didn't have health insurance. Okay. But if it's a yes, I really do need to have the old insurance carrier and the policy number to be able to move through the website. And then again, dependent information if they have dependents, and then a signature. Also very helpful on the website. Is at the top here. We do have our invoicing protocol here, which is good to read through. And again, if you have questions, feel free to call or, send me an email. But this kind of explains the whole month ahead. When I get those rosters, the rosters from Excelis usually get to me around the 15th or 16th of the month, which means your changes for anything really need to be in the system by the 13th of the month for the following roster. So this really explains that, how it can take, if you don't get it in early enough in the month, it could take up to 2 to 3 months to see that credit or addition to your bills. So if you read through that and have any questions, you can give me a call. And I just wanted to say, you can probably expect to see, I'm done sharing, I guess. That you can expect to see your first invoices from me and rosters. It should be by the end of November. So for January, so definitely then if you have any questions, feel free to email me or give me a call on those new invoices. Back to you, Elin.
Great, thank you. Thanks. Any questions for Jessica about the invoicing and accounting process? Okay, then we will, then we will keep moving forward. I am going to now share the share the website. I think Deborah, you're going to have to stop sharing. Have you stopped?
Yep, I stopped.
Okay. Are you all seeing the website?
Yes.
Okay, great. All right. So couple things, where they are, where you can go. You can always call me, but if you can't reach me, you can always go to the website for some of these resources we're going to be talking about. So under the Employee, Retiree, and Wellness Information tab, it says Plan Information by Municipality. So if you click on that, there are all our current members are listed, and this will be updated soon with all of our new members. If you click on your town, so I'm going to just use Town of Ithaca as an example, it will list. Town of Ithaca has 4 different options for their employees. And if you click on the blue highlighted, it will give you your plan summary. So these were the plan summaries that you have all looked at as part of the application process. So when comparing your old plan to your new plan, this is probably what we shared with you. It is the benefits. This is the platinum plan that we're looking at right now, even though it says signature copay 1. That's what Excelis calls it. We call it the Platinum Plan. And that's there. Your employees can reference it there. If you have any questions, oh, what's our copay again? You can look here. What's our deductible? Now, in a moment, I'm going to talk to you about some changes we have had. Very soon, we will update our website, and the 2021 plans will be coming on soon, or they will be emailed to you soon. So you have them for your open enrollment and can be prepared for what the plan is when your employees are eligible to be covered under our plan. So these are in the process of being updated right now. It's the last thing I did at my desk yesterday. Hopefully, Beth, you got my emails, and Rob, regarding those plans. So this is always here for your employees. A great place when employees come in and say, hey, how much am I going to have to pay if I go to urgent care? And you can look that up on here, and it will tell you, and your employee will know. And we will learn later that they can also call Excelis directly and find out that information from Excelis. Now, one of the things I'm going to ask you to please note is that the prescription plan information is over here on your right. That is because Excelis does not adjudicate claims for our prescription drug plan. That is ProAct. So if you look at just the Excelis summary, it will say that they only cover contraceptives, but the rest of the generic brand preference and brand, how that is paid, and the mail order is all listed there on your right. So that's where you can find this information. And yours will be updated in the next month, probably. We're just gathering all that information now. The other thing I wanted to show you on this page, premium equivalent rates. We have already posted our premium equivalent rates for 2021. I know some of you have contacted me directly, and I've sent you that information. But if you're looking to see what is going to come on that invoice that Jessica is sending you, if you click on the metal level plans, all of you are offering metal level plans. You're either in the gold plan, the silver, or the platinum plan. I don't think we have any bronze plan. And the premiums for 2021 are listed right down here. So those are the new premiums. This is a chart that Rob updates for us every year. And then we post it on the website so everybody has access to it. We approve our increases to premiums in September at the September board meeting. So that after that, we will post it on the website and also usually send you an email and let you know it's there. Okay, any questions on that? And I'm going to jump to some other information since we're right here. And under the board, under governance, so I clicked over to governance. So I'm under the governance tab now. Under the board of directors, any changes we make are in here. The resolutions of the board are kept here by year. And we had a few changes to some of our benefit plans. So when Don came out and did the presentation, he would have given you 2020 deductible levels and out-of-pocket levels. So first go around, and I'm doing some of this in a long fashion, just so you can understand our practice and policies, how we go about making changes. At the consortium, you are a member, you're not just purchasing insurance. And as a member, you have a seat on the Joint Committee of Plan Structure and Design. So you receive a seat for one management person. That can be the person you assign to the board. It can be you as the benefit clerk. It can be your HR department. Some of you are all of those. It can be a representative you feel is appropriate to sit on the Committee of Plan, Structure, and Design. The other people that sit on that committee is each labor union represented within your organization has a seat at that board. So in Tompkins County, they have a CSEA white collar, they have a CSEA blue collar, they have road patrol and corrections, I guess, sheriffs. So they have 4 seats at that table. Now, all 4 people don't come all the time, but labor is very involved in the process of changing plans. So every year, if you're a part of a metal level plan, it is published through Medicare, Medicaid, Medicare website, an actuarial value calculator. And it's an actuarial value that is assigned to each plan, bronze, silver, gold, platinum plans. And you must come within 2 points of the actuarial value. So for a gold plan, it's 80%. So you need to be within that to be compliant, to be a gold plan under, I believe it's under the Affordable Care Act. So that's something that Rob Spinard and the team at Losi and Cahill do for us. Is they pull up the actuarial value calculator, they put in all our plans, and then they make recommendations to the joint committee if we are in compliance or not in compliance. And usually if we're in or out of compliance, tweaking the deductible and the out-of-pocket maximum puts us right back in compliance. So that's why your plans change every year. When you're wondering why Excelis is doing something crazy, it's usually to remain in compliance with the actuarial value calculator. We have to live by the same rules as well. So this is the resolution that went through to change deductibles on the gold plan for both single and family, and what it was changed to. So the deductible on the gold plan went from $1,400 to $1,500 for a single, and from $2,800 to $3,000 for a family. And then same thing with out of pocket. So we have in network and we have out of network on this resolution. So that's, those were changed. Those will be updated on those benefit summary sheets. And that's an easier place to look in the future. But just to let you know the process we go through when we are making changes to the plan. So the whole joint committee has to support this. We have to have a majority vote to, we first have to have a quorum, then we have to have a majority vote to advance any changes to any plans. And that's one of the things when Don Barber comes out, he says it's not a surprise when you're a member of the consortium because you are part of the process and you're part of changing any of our plan changes. And so we'll talk about the next adjustment that was made was to our out of network. We had out of network, I believe, was twice as much as in network, and we felt that that was too steep. So that was discussed at the joint committee, and now out of network would is only 150% higher than it previously was, or 50% higher. The differential is 50%. Let's say that the differential between in network and out network. So that's changed the out-of-pocket maximum. The deductibles were the deductibles we discussed before, but then the out-of-pocket maximum were updated, And this is the resolution that updated those out-of-pocket maximums, which actually brought them down from probably the out-of-pocket maximums you saw when Don was comparing 2020 plans from your current plan to our plan. And once again, this will be updated on the summary plan description. So you don't have to worry about jotting down all these changes. It will be automatically updated on that. And then the next change we made was a very favorable change to the plan. You may have noticed that with your Excelis plans, comparing it to the consortium plan, that we didn't have hearing aid benefits, but we also didn't have any hardware for eyewear. So we have now added hearing aid benefits to all the metal level plans and the Medicare supplement plan. And the bronze plan did not have any eye or hearing. I think maybe they had eye. Let's see. No, they didn't have eye or hearing evaluations on their plan. So we added that to their plan. So now all the metal level plans have a hearing aid benefit of 50% of the co-insurance once you've, subject to deductible, and you may purchase a hearing aid every 3 years and be covered with a maximum benefit of $3,500. So that's for the 4 metal level plans. Also, eyewear is now a $60 reimbursement for frames, lenses, or contact lenses, and that's an annual benefit as well. So those were additions that have been added to our plan, and that's the process to add things like that. So it's great that we have this committee that can look and evaluate and make sure we are remaining competitive with the marketplace, but also providing fair opportunities for all our members to secure reasonable benefits. So that's everything on the website. While I'm here, I will show you one other thing because we will talk about this later. Wellness. When we send you out a wellness related flyer, we will post that also on the website for you to reference and for your employees to reference. We also organize flu clinics every fall, and we have 2 more flu clinics left. Well, I guess today Trumansburg is doing theirs, and on Thursday, the town of Ithaca is doing theirs. I think that's 7 of 7 right there. We've already had 5 conducted so far. So we keep wellness information here, the most current wellness information on this tab. So if you ever need to reference that or your employees do, you can come right here and reference that. I think that's everything I wanted to cover on the website for now. So I think, Deborah, I will stop sharing and you can go back to sharing. There we go. All right. So we talked about the board approved changes to our benefit plans. There are 2 government mandated changes coming this year. So every year, either New York State or the federal government makes changes to medical plans in general, and we will let you know what those changes are. So this year, there are just 2. One is there is a booster shot to the anthrax vaccination that was covered under preventative services, and the booster shot will be covered under preventative services. The next thing is for diabetes, insulin, the out-of-pocket max that the maximum that you can pay for insulin is $100. And I'm going to ask Corey. Corey will explain that now because most of you won't pay $100, but we'll have him go ahead and cover that.
Yeah, thanks, Elin. So yes, it is $100 per month. So it's not just a one-time thing that you can pay up to $100, say, per year for your insulin. It is $100. Think of it as a copay maximum, right? So the maximum per month you'll pay is $100. And I will also say, as a caveat to this, there are a lot of injectable products that you can take for diabetes, not all of which are insulins. So it's important to remember that under this mandate for the $100 monthly maximum, that is specific to insulin products only. So I think that's the most important part, because I think a lot of people are going to be confused thinking that what they take is insulin when it's not truly insulin. It's a product to help them with their diabetes. But people, I think, correlate the fact that it's an injection and that's how you take insulin. So thanks for that, Elin.
Okay, great. All right, so except for Lansing, you're all coming in new. If you do make a plan change in the future, so you want to go from the gold plan to the platinum plan, or you need to save money and you're going down to the bronze plan, whichever direction you head, you need to let us know by October 15th. So we would need your resolution that you as a town have elected to change your plan. And one of the reasons we need that is so we can change your election in the system. So Excelis can update their system. They can communicate to ProAct. ProAct can update their system, and then your employees can get ID cards by the first of the year. So if you ever make plan changes, please know we'll send out a reminder. You need to notify us by October 15th of those plan changes. And then that is what you would advertise during your open enrollment period. For all of you coming on board new, it's a good thing you're all with Excelis, because that makes it kind of easy. So what happens is Beth Miller and her team, they scoop up your plan and your participants in the plan, and they move them over to the consortium. So you don't have to do any data entry or make the changes. Jessica will not make the changes. The changes will move, your current roster will move over. And then Jessica will send that out with the first bill. So if there are any changes to your employees, if someone's retiring or you just had a new hire or something, you can send the application with the change on it to Jessica. Jessica will input that into Excelis, and then we will see that come on the next roster. So that's how changes will happen in the future. But for 2021, we're going to scoop them up where they are. We're going to move them over to the consortium as they are. We are doing that so you can get ID cards before January 1st. So I cross my fingers that they will be in all your employees' hands by January 1st, because there's always someone who, gets sick on New Year's Eve and has to run out on January and fill a prescription or something, or their child has an ear infection and they wait until the 1st or 2nd to get it taken care of. We want to make sure you have those cards. Please note you get 2 cards. You will have an Excelis Blue Cross Blue Shield card, and you will have a ProAct card for the pharmacy. So if an employee goes to the pharmacy and gives their Excelis card and they say, you don't have prescription drug coverage, and then they call all upset and say, I knew you shouldn't have switched. These are horrible benefits. We have no prescription drug. Please remind them that they have a prescription drug card with ProAct. So there are 2 cards. And I know it gets confusing for those of you with an HRA because then they have 3 cards. They have the credit card that they use to pay with the HRA, the Excelis card, and the ProAct card. But that's how we manage benefits now.
Elon, this is Rob. If I can just add something to your discussion on plan options and changes. We do ask for roughly 60 to 90 days in advance, just so the consortium, Excelis, ProAct, as well as LoC and Cahill can kind of get everybody on board and to update our systems appropriately, just to give us ample time. So we do ask for those changes to be addressed well in advance, roughly 60 to 90 days prior to the first of the year. So I just wanted to add that. I know it's something that we have stressed in the past.
Thanks, Rob.
And Elin, this is Beth. I just also want to add a little note to that. When we're changing plans for the meta level plans, we'll want to do that on calendar year because those benefits run on a calendar year. Typically, what happens is plans are negotiating during the year, but as you had indicated, we want to make sure that they get the information to the board so that it can be approved at the board level for the changes for the upcoming year.
Perfect. Thanks, Beth. All right,
Thanks.
next slide. So we're assuming all of you will be going into your open enrollment period. November is usually open enrollment for the consortium, and that's changes that will be effective for January 1st. And Eric will cover open enrollment versus qualifying event in his presentation. But basically, if you are making a change, you're changing plan or you're adding someone to the plan or taking someone off the plan just because you didn't add them before, not because there was a qualifying event, then this is the time of year that you can do that. So without any questions asked, November is the time to make plan changes. And then all of those plan changes need to be to Jessica by Thanksgiving. So Jessica can have them to Excelis by, I believe it's December 2nd. And then after that, we go through a very dark period with Excelis where they don't allow us to touch the system. So make sure you get your changes in by December 1st so Jessica can make those changes, which then gets ID cards out on time. So that's open enrollment. Also just want to let you know, Eric will talk about some COBRA information this year because a lot of municipalities were making tough decisions regarding their employees, including layoffs and furloughs. We received a lot of questions on COBRA, and the COBRA, we now have a COBRA toolkit with just questions and answers for you, some samples of COBRA letters. So if you don't have a COBRA administrator and you are administering COBRA yourself, we can be helpful to you in making sure you know all the restrictions of COBRA. So don't hesitate to contact us for that. As you join the consortium, some of you I've already talked to about this, is the beneficiary audit. When a new group comes on, we ask that the administrators make sure that you have all the paperwork for all of the dependents. We have found through our own audits, we periodically do an audit, and we will probably do an audit in 2021. We ask all municipalities to go back and make sure if there is a child covered, you have the birth certificate and that the parent that's covered under your plan is actually the parent of the child, because sometimes we have domestic partnerships or other partnerships that break up, and those children, or there were stepchildren and they're no longer qualified because that marriage was annulled. We want to make sure that spouses are spouses, domestic partners or domestic partners, children or covered children, and any other appropriate beneficiary. So when you come on board, we ask you to do that check and make sure that all of the dependents are actual dependents. And we have you sign a statement that you have audited that, you have all of those certificates in your files, and you believe the beneficiaries to be true. We, as a consortium, have spent a lot of money in the past on dependents that weren't actually dependents of an employee. So we want to make sure we do this. We don't need the birth certificates, the marriage license, anything like that. We just need you to make sure you have it in your file and you are signing the beneficiary audit and you are sending that sheet to us through the portal to Jessica. So that's what we're doing in the beneficiary audit. All right. And now I would like to turn it over to Corey to introduce you to the PROACT family.
Yeah, thanks, Elin. So again, everyone, my name is Corey Prayshaw. I work for PROACT, and maybe a little bit of background on who PROACT is. If anyone's familiar with the chain of Kinney drugstores, we are actually owned by the same company. So we're an employee-owned company, have been around since 1903. We are obviously a little bit different than Kinney Drugs in that we provide pharmacy benefits for self-funded employer groups like the Greater Tompkins County Municipal Health Insurance Consortium. So looking forward to working with you guys. We could jump ahead to the next one. So really, I think the most important thing, especially right after January 1st, when people have cards in their hands and they're going to the pharmacy for their first prescription, is our help desk. So our help desk is available 24 hours a day, 7 days a week, 365 days a year. So in that, we do have live representatives that answer the phone 20 seconds or less. Now, here we have bolded, it's the most important thing. If you have members or an opportunity to talk to your employees, make sure that they understand, hey, if you have any issues, no matter what it is, please call PROACT before you leave the pharmacy, because more often than not, what happens is the member goes to the pharmacy, has an issue, and it's something really simple that can be handled in 10 seconds or less. They have to leave the pharmacy, go to you, talk to you, say, hey, I went to the pharmacy, did I use my new PROACT card? It just didn't work out for me. Can you figure out what's going on? Once you get that all figured out, it's been a day and that person is gone without their medication. Whereas if you call or the member calls while they're at the pharmacy, a lot of the time they can walk out with their drug. Another important thing to know is each of the meta level plans have what's called prior authorization and step therapy on them. Some drugs that members are on today that they've been on will require prior authorization and step therapy, which could cause a prescription to reject at the pharmacy saying, hey, you need to go through that prior authorization or you need to go through step therapy. We do not want someone to wait for a prior authorization or step therapy for their first prescription fill. So again, before they leave the pharmacy, if they get that rejection in the pharmacy, which a lot of the time they do, they'll call us to see if there's anything they can do. We do allow a one-time override. So what happens is we allow the prescription to process. that needs a prior authorization. And then while that's being filled and while the member now has a month worth of their drug, we reach out to the doctor and we do the prior authorization. That way there's no lapse in their therapy. So that one's ultra important, right? Because that's the number one cause of disruption outside of, I think, as Elin said, forgetting that you have a couple of different ID cards and forgetting your ProAct card when you go to the pharmacy. But those are the big ones. And just remember that we are available. Our help desk is available 24 hours a day, 7 days a week, 365 days a year. The number's here as well as on the card, and the welcome materials that members will receive. The online resources, I'll be brief here because I will take over the screen at the very end, just to show, what our website does, what it looks like. On the website, a lot of the same things that you're going to find on the Excellus website, your claim summary, your prescription drug claims, the drug cost comparison feature, which is a great tool for anyone that's on a plan with a deductible where the member has to pay first dollar. You're able to look up what specific drug and how many, I'll say, pills you get every single month. And you're able to look in a certain area at which pharmacy has the best price on that drug. The pharmacy finder is, I'll say, essentially useless because you would be very hard pressed to find a pharmacy that did not participate in our network, especially in the state of New York. The account information, great tool for if you use our mail order service, which I'll talk about here in a minute, in changing your credit card, changing your address, adding alternative addresses, printing a temporary ID card. What's important with the website, and I'll talk about this again with the website, create a profile on the website as soon as you get your ID cards, just after January 1st, because in order to create a profile on the website, you need your ProAct ID number, which is on your ID card. So if you're trying to make a profile on the website in order to get a temporary ID card, because you don't know your ID number, you're not going to be able to do that. You're going to have to give us a call, get the information, or we can certainly walk you through getting set up. And last but not least, the formulary lookup tool, which can be used to find out where a drug lies on our formulary, whether we consider it a generic or a tier 2 brand or a tier 3 brand, and the corresponding copay that goes along with that drug. The mobile app, just really quickly here, the mobile app certainly has a lot of the same capabilities as our website, but the thing we like to point out is people had some trouble finding it. That were interested in using the app rather than the website. You do have to search ProAct space RX. It is available on the Google Play Store for Android as well as the Apple Store on your iPhone. But that's important. If you type in ProAct, it might be farther down the list and you might not catch it. But ProAct space RX will get you there first try every time. The mail order pharmacy. So a great option for members, especially nowadays. The mail order pharmacy offers 90-day supplies of prescription drugs that we consider maintenance, right? So they're drugs that you're taking every single day for things like blood pressure, diabetes, high cholesterol. You can get those for a reduced copay or reduced cost in 90-day quantities. So you're going to the pharmacy less often, you're paying less. And again, the times that we're in now, people are leaving their houses, as little as possible. It just makes it really convenient. Something you don't have to think about. There is, and we'll talk about this a little bit later. There is an automatic refill component associated with the mail order pharmacy. So really, it's very hands off, especially for those drugs that you're going to take and you're going to continue to take for a long period of time. The mail order pharmacy enrollment and some of the capabilities, some of which we've talked about, but enrolling in mail order is quite often as simple as giving us a call. I always say that's the easiest way. One, as we talked about with the help desk, it's very quick to reach someone. They're a live person that's based either in Governor, New York, up here on the Canadian border. I don't expect anyone to know where that is, or Syracuse, New York. In 20 seconds or less, you'll be talking to a person. By enrolling by calling, what we're able to do that we're not able to do on the website is, if you aren't going to your doctor's office as often as you usually do, which is certainly the case in a lot of places right now, we can actually reach out to your doctor for you to get a new prescription to send to the pharmacy. That way, you don't have to make an appointment, which may be tough to get in the first place. I truly think that calling is probably the easiest way. It takes about 5 minutes, whether you do it on the website or by calling. But I think it's by accessing your prescriptions, the phone calls is probably the best. I think it's got a leg up. The order status, once you're enrolled and you've got a prescription here, you're able to see where your prescription is in fulfillment, whether we have the prescription, whether we're filling it, whether it's shipped, and then of course the tracking information. And then the refills, you can do that by phone. We have an integrated voice recording that you can just type in your prescription number. You'll see on the website, there's an option there that just allows you to click on the prescription and send it out, all very, very quick. And last but not least here, the international mail order pharmacy. So this is something that's probably really new. I think everyone's at least a little bit familiar with mail order pharmacies. CanRx is kind of a different ball game. It's very interesting, and it's an incredible benefit that the consortium offers. So CanRx is an international mail order pharmacy. And what that means is CanRx works to provide, again, some of the same maintenance medications to members in 90-day quantities, although this is brand name only drugs. So these are some of the more expensive drugs that we know about that you could be paying $50, $70, $100 for. They offer those to members for free. So a member filling through CanRx does not have a copay. Now, the list of drugs is smaller that they can fill. I encourage everyone to go either to the CanRxSavingsProgram.com, or there's a good amount of information on CanRx on the consortium's website, as well as Elon had went over earlier. There's about 350 brand name drugs. Oh,
We can send you more. And if people are interested, we can point you in the right direction. So don't hesitate to ask.
Sure. Yeah, no, good point, Elon. Yeah, so there's about 350 different brand name medications that are available. And I should also say that all of these medications are sourced direct from the manufacturer, which is the same manufacturer that makes the drugs that you get here in the United States. But I think if you watch the news, you watch politics at all, one thing that has been made very clear over the past number of years is that the same drug in the United States often is twice as expensive as it is in the United Kingdom, Australia, New Zealand. Again, some of these countries that our Congress designates as a tier 1 country, like that in the United States, the drugs are just so much less expensive. There are a lot of barriers that those countries don't have to go over. Also, the fact that their government negotiates drug prices helps quite a bit. So CanRx works directly with those manufacturers and those pharmacies to ship prescriptions in the sealed manufacturer bottle, similar to what pharmacies get. Again, 90-day supplies, but you go from paying upwards of $100 for every 90-day script that you get to $0. So it's a great benefit. You can't argue that. And I'll steal the show, and we'll go over the website just really quickly. Okay, is everyone looking at the website?
Yep, we can see it.
Okay. So here, just logging in, you'll proactrx.com. This is where you'll land to log in. I'm going to log in. You'll see here, I just have a test member loaded now. You'll see the member ID. Here we can click on claims history. This is someone that doesn't actually exist, so they don't actually have any claims. But if I clicked here, it would show me all claims from any pharmacy that I went to, which is a great tool for when you're calculating things like how much you've spent for your deductible, for your HRA or tax purposes. You can use the Excelis website to total the amount that you've spent in medical stuff, as well as the prescription drug part through our website. Here's the print temporary ID card, which great tool for parents with college age kids that are still on the plan. You can print this, or you could even just pull it up, take a picture with your phone and text it. I don't know how many people we get that do that for kind of those one-off prescriptions. Someone gets strep throat, they need an antibiotic. They didn't take a prescription ID card to college with them, didn't think they'd need it, but still are covered, so why not use it? Down here is the actual formulary. So if you click on this, I won't, because it'll pop up and you won't be able to see it anyway. But by clicking on this, it actually shows our full formulary. So all of the drugs that PROACT covers, whether they need prior authorization, whether they are subject to step therapy, quantity limits, our opioid management program, all of those things are detailed right there in the formulary, which can also be found here, like we talked about earlier, on that formulary lookup tool. So there you get to actually just type in your drug. You don't have to search for it. And it'll tell you everything you need to know about what you need to do to get that, which might be as easy as just getting a prescription. And other times it may be, hey, before you get this drug, we'd like to see you try this drug, which would be kind of that step therapy aspect. The drug pricing tool, I won't go through a full exercise, but again, this is that great tool that'll show you how much the drug costs at, say, CVS versus how much it would cost if you went to Kinney Drugs or Green Street Farms. So you choose a drug here, pick it. It goes by drug strength, different variations of the drug, pharmacies. So you can either pick a few different pharmacies that you have in mind, or you can actually type in a zip code and then create an area of, say, 10 miles, 20 miles. You can choose a doctor. It shouldn't make a difference on the consortium's plan who the doctor is, but that's how specific it gets. And then day supply. So are you getting 1 month? Do you want to see how much a 90-day supply would cost you at CVS versus the mail order pharmacy? And the quantity, which would be quite simply is how many pills you're going to get over that period. So again, a great tool. It'll show you all the steps you need to go through, how much drugs cost, and all of that great stuff. The mail order pharmacy tab is important if you want to use the mail order pharmacy, if you've gotten set up. So the My Prescriptions, after we've received prescriptions into our pharmacy, they'll show up here. So you'll be able to refill your prescriptions, see where they are in fulfillment, as well as the My Orders or the order status tab here. You can actually see, okay, well, looks like PROACT got my prescription. They're filling it now. It's set to be shipped on this day. The tracking message, which can be set up automatically to be sent to you by text. It can be emailed to you, or you might not get a message at all if you don't opt into it. But that tracking message will say, hey, you just had an order shipped from PROACT. Here's the tracking information. Thanks for shopping. Great tool, especially, as we're all running around constantly, and, you might forget that you ordered a prescription and you might be running around traveling, and you want to be around for when your prescription actually shows up. The My Address is important, I think, mostly for the snowbirds that are now returning south to their winter homes. You can update that. So if most of the year you're in upstate New York, you have your New York address, and then this time of year you make your trek down south, you can update that to your other address. That way, the next time a prescription ships, if it's filled automatically, it'll be sent right to that new address. You don't have to worry about a forwarding address or anything like that. The enroll prescription as well as the auto refill, that's how you designate which drugs you want to be automatically refilled. As a standard, none are automatically refilled. I should point that out because a lot of people assume, hey, I thought you had this automatic refill program, but certainly the last thing we want to do is send out prescriptions that someone wanted to get maybe one time. They knew they would need 90 days worth, but they aren't sure that they're going to take it again. They have a doctor's appointment coming up at the end of the month, and they don't think they're going to be taking any anymore. They don't need another 90-day supply of that. So automatic refill, you have to opt into that. You can opt in per drug, or you can opt in for all of your drugs and all future drugs if that's something you're interested in. The payment methods last on the mail order side is simply how you add, remove, change credit cards, whether that's an HRA, HSA, or just a debit or credit card to pay for your drugs that you get through mail order. The My Resources tab, I'll use this as another plug for the consortium's newsletter, as well as some of the information that's already on their website. It's just a great tab on diabetes that Ron, who you may come to know, our clinical account director, spends a ton of time creating some of these documents that go through great information, not just on diabetes. Here we have a lot of information on diabetes, but a lot of other conditions. He spends a ton of time going through. So certainly not going to go through all of them, but here we have some different articles, some of which have been featured in that consortium newsletter, as well as some different resources, right? From the One Touch brand of products, the Cornerstones for Care, which provides some other tools available for free for diabetes. So a ton of great information on that. So I will stop sharing, ask if there's any questions.
Thank you, Corey. I guess we'll move to Beth.
Perfect. Thank you, everyone.
Can you not hear me? Hello?
I think we can hear you now.
Before
All right. Okay, I was talking. So with that, I'd like to introduce Beth Miller from Excelis, and Beth will introduce the roles of everyone else on her team. Thank you very much, Corey, and we look forward to hearing what Excelis has to say.
Great. Thank you, Elin. And Corey, nice job. There's a lot of information out on your website like ours, and we'll get a chance to explore that. Again, I would just really want to thank everyone for joining the consortium. You'll see a lot of similarities that you've enjoyed in the past with Excelis, but it is a new twist through the consortium, and the fact that you're able to actually control a little bit more of your own destiny and enjoy much greater savings through the consortium in purchasing health insurance in that fashion. As Elin's indicated, plans are similar. Our provider network is 100% the same. So that confidence that your members are going to be able to not have to worry about changing doctors is enormous. So very excited to have you. You heard Jessica talk about some of the billing changes. I'll have Eric Kohler on shortly, who will go over some of the guidelines, some of the things that will help you navigate with Excelis Blue Cross. So again, welcome, same service, same network, and you get me and Terry Godfrey. Unfortunately, Terry Godfrey, my account service consultant, who is a lot of my right hand. I kid around. She works directly with me on the Greater Tompkins Municipal Health Insurance Consortium. And we work with Elin closely and determine how we move forward, along with Losi and Cahill and your pharmacy benefit manager, ProAct. So it is a moving ship, so to say, but it's running very, very straight and narrow and cost efficient. So with that, I'll just get into a couple things that you need to know regarding navigating Excelis and the consortium together. So right now, if you aren't yet familiar, Excelis Blue Cross does have a business resilient plan in place. We'll talk about the COVID updates and what's going on with the pandemic and how to find the most current and up-to-date information. I'll talk about Terry Godfrey and my role as it relates to the consortium, and then talk about our customer care unit. We'll also round out the Excelis presentation with Jason Warshaw, who will talk about our wellness programs and how to navigate through that. I think you'll see information coming from the consortium and Excelis a little more readily as we talk about the information flow to your members. So as of March, we had the COVID-19 hit, and it was kind of different. As we know, 2020 has been an extremely challenging year. Some of you may be working remotely. Some of you may be doing part-time. At Excelis Blue Cross right now, we are 100% remotely working. And the exciting thing about that is we moved into this work at home model without a skip in service. Everything is fully operational. We will be working through right through the new year. We are working 100% virtual. So these meetings going virtually, again, always a challenge, but we're working through bugs and we're learning more technology than we had previously. I can say that for myself. So let's talk about the pandemic and COVID-19. There's been a lot of questions, a lot of learning that not only Excelis members, providers, having to chart new waters in unfamiliar territory. So a lot has happened on the COVID side of the house. We've been working with providers. We have an entire dedicated section of our website on the most current information on COVID regarding testing, social distancing, washing hands. There's a lot of information that you can pull from that. But really, what you will find, and you want to stay informed, is the most up-to-date information for when you have a member who comes in and says, my son or daughter's going to college, and the college just told me that they need to be tested once a month. So is that covered through health insurance? And that's where you'll find it, right on our COVID website. And the answer is no, that's not covered for a pandemic control. If a member is having signs of COVID and a doctor's prescribing them to receive a test, then that would be a covered benefit and covered in full under the state of emergency. But if it's just getting tested just to say, oh, I want to make sure I don't have it, It's not going to be covered under the health insurance. However, there are local and county resources that members can check to see if there's clinics or drive-by testing facilities available. And again, that's my state inform information. And account management, unfortunately, Terry had to step away. As I said, she is my right-hand person. She is very integrated within the consortium. We do handle questions through Elin, and if you have billing questions, they're typically through Jessica. But if there's a group situation, we do take those concerns and we research them. Typically, and really where you want to lead members to who should be utilizing the ID number on the back of their identification card. That gets us, has the member directed directly to our customer care unit. They have access to look up claims, they quote benefits, and it's all documented. So for someone who may be coming into your office and says, oh, I'm not 100% sure, I'm going to have this surgery next week, can you tell me if it's covered, or do I have a copay? You should be directing them directly to our customer care, who will actually quote the benefit, but they'll also research to make sure the provider's in network. So again, they are your number one go-to. And then thanks Debbie, as you'll see on the information, I put up the customer care hours, 8 to 5, and on Friday, 9 to 5. They have online access and lots of information on our website, which Jason will review. You have member ID cards, you can pull them up on our mobile app. You can see your benefit summary, deductibles. You can also access your statements, your monthly health statements, which are the same as you received today. So that's kind of a quick overview of navigating some of the things that are coming up, especially with COVID, our website, Terry and I, management styles. The next, I want to turn the presentation over to Eric, who is our Director of Membership and Billing, and he'll go over some of the most frequently asked questions where you may need support and learn how to navigate the system when realizing you have many of the answers right at your own fingertips. So I'll turn it over to Eric.
Hello, everyone. Good morning. It looks like I'm having some trouble with the video this morning, so I'll just do by voice. And thanks for having me. The first couple of slides we have here are just talking about initial enrollment opportunities and enrollment opportunities throughout the year. There's really three times that you can add new folks to the plan. So initial enrollment is really the enrollment opportunity for those new hires. So freshly joining your group, those who have been rehired, and also eligible dependents that gain new eligibility rights. So that would be examples such as marriage, birth, adoption of a child, and there's also something called a qualified medical child support order, which is a court request or from county services to add a dependent to the plan as well. So those are some examples of initial enrollment opportunities where someone gains new eligibility rights. And then as we talked about earlier on a little bit, open enrollment, we're heading into that right now. For this group, the effective date is January 1st. And we talked about the importance of getting all those changes and benefit change requests and dependent adds in starting now and throughout the month of November to ensure that people have coverage January 1st and they have those ID cards in their hands. So that's really the one time a year, kind of no questions asked. Anyone who didn't enroll in the past or decline coverage in the past, they can hop on the employee benefit plan with an effective date of January 1st, and enroll any dependents that they might want to add, or they can also disenroll some dependents, right? So if a dependent doesn't need any coverage and they want to take them off, they can also do that for open enrollment or any time throughout the year based on the consortium's guidelines, which is coverage through the end of the month. So you can voluntarily disenroll throughout the year, but January 1st effective date is really the open enrollment where anyone who didn't have coverage in the past can hop on. Special enrollment period. So this is kind of the period that arises from experiencing a qualifying event. So the qualifying event is kind of what happened that leads to the special enrollment period. So you might qualify for a special enrollment period throughout the year. Some examples of that is, you know, a newborn would be a new dependent. Someone involuntarily loses coverage through a plan. So say we have a employee that was covered through his or her parents' plan and they've reached the maximum age under that plan. So they're losing coverage by no choice of their own. That would lead to a special enrollment period for them to hop on their employer group's plan as an employee. And there's some other events that might lead to a special enrollment period, such as network limitations or moving in and out of the service area. If you lose coverage through a government program such as Medicaid, that involuntary loss of coverage would also lead to a special enrollment period. Events that don't create a special enrollment period would be voluntary loss of coverage. So if someone comes into your office and they voluntarily choose to end their coverage just because they don't want it anymore, they wouldn't be able to come back on the plan until open enrollment or they experience another qualifying event that leads to a special enrollment period. COBRA cancellations due to non-payment. So if someone chooses to not pay their COBRA premiums, that doesn't give rise to a special enrollment period either. A couple examples of some ineligible subscribers. Contract employees and temporary employees would not be eligible for insurance through the employer-sponsored plan. Examples of some eligible dependents, so spouse, and then we have the children of the subscriber, and that does include natural children upon birth, open enrollment, or if they have a qualifying event. Stepchildren as well, they're generally added on the date of the marriage at open enrollment, or if they experience a qualifying event, but stepchildren under the age of 26 are eligible dependents. And then we also have proposed adoptive child and an adopted child. So there's different stages of the adoption process. And there's some general guidelines, and the full guidelines will be in the employer guide, which I'll show a screenshot at the end of where these rules and kind of guidance can be found on the websites. Legal guardianship. So a somewhat frequent question that we get is, what about grandchildren, things like that. So if the subscriber legally adopts the grandchild, or they have legal guardianship, and legal guardianship is different than custody. So there's some nuances there. But generally, if the subscriber has legal guardianship, the child would be an eligible dependent, and that can at times include grandchildren if they've adopted or obtained legal guardianship of the grandchild. And then adult dependents too. And that includes a domestic partner and an adult disabled dependent. So there is a separate form required for adult disabled dependents. We do send those to our medical director for review. So there is a medical review process that takes place, and it's really important. We send age off notices to the different groups of children who will be reaching the maximum ages. So for example, if you have a child that is reaching the maximum medical age of the contract of 26, and they're going to be aging off the coverage, it's really important to get that form and the process initiated as soon as possible. We send those notices out a few months in advance, and then we do need to receive the application for coverage within 31 days of when the child ages off the policy and start the medical review process. So if there's a child who's aging off and they are a disabled dependent, there is that separate form and that medical review process that we can help you with and guide if you have any questions. But it's important to do that timely and not wait until more than 31 days after that age off has already occurred. Examples of ineligible dependents. So a former spouse, once a divorce is finalized and the paper is filed with the county clerk, I mean, that's when we generally deem the divorce final. So if there's discrepancies over what date to use, we generally look at the date the paperwork is filed into the county clerk system. So it's important really to get those ineligible dependents off the plan as soon as possible. As Ela mentioned early on, we do see some claim expenditures or claims usage for dependents who are really ineligible but are kept on the plan longer than they should be, just because we didn't know about it or we didn't submit the cancellation request timely and they've utilized claims. And there's some negative impact there too. So it's really important to get these ineligible dependents off the plan as soon as possible. The children over the contract age limit, that'll automatically happen in our system. So we send those notices of those reaching the maximum age, but today on our system, if we add a newborn, our system will automatically age them off 26 years in the future. And so our system takes care of that contract age limit and hitting that to remove those off the policy. Grandchildren, we discussed a little bit. So if the grandparent adopts or becomes the legal guardian of the grandchild, that's a different scenario than just asking if grandchildren can be covered on the plan. Foster children, parents, grandparents, aunts, uncles, brothers, sisters, those are all examples of ineligible dependents. So we recently had the case pop up. Someone had their parents on their tax return and they live with them and they're a dependent, but under our contracts, the maximum age is 26. So the parents are over the age of 26 and they wouldn't be considered eligible dependents. And also foreign exchange students who live with the host family would not be considered eligible dependents. So what happens when a dependent loses eligibility? We send out the maximum age notices. The group gets a summary as well as a subscriber notice goes out. The group summary goes to what we call our subgroup address. So those summaries will be by subgroup. Some groups have multiple subgroups. Some might have one, like the 0001 subgroup might be for the active employees, and there might be retiree subgroups as well. So those maximum age notices and group summaries are composed by the subgroup level of each of those populations, and those are mailed to the group and the address. So the age off at 26 automatically happens at the end of month. Other losses of eligibility brought to your attention. So those we want to submit the cancellation transaction immediately as soon as we can, and when you learn that a dependent is ineligible. So if someone passes away or there's a divorced spouse or someone who doesn't meet the eligibility requirements for the plan, we want to cancel those ineligible dependents as quickly as we can to mitigate any additional claims exposure to the consortium. Probationary period, this is just a general definition that it's a term that we hear. So if someone's newly hired with the group and there's a waiting period that they have to wait until they have coverage effective, healthcare reform limits that to medical products of 90 days. So the most that you can make a new employee wait for health coverage is 90 days. Some groups might be effective immediately upon the date of hire or first of the month after. So there's some variations in there what we can allow, but we can't go over the maximum of 90 days due to healthcare reform. But that's just the period of time that someone has to wait for group coverage once they're hired or rehired. COBRA continuation of coverage. So federal law and New York state law have different provisions. Federal law is really the COBRA, and then New York state has continuations. So the federal law applies to employees with 20 or more employees in this consortium joining for Medicare rules and COBRA purposes. Rules would apply for 20 or more. And COBRA is really, continuation is really the best word to use to describe it, because it is a continuation of the coverage that you had the day prior to qualifying for COBRA. So if you leave employment, it's not a qualifying event to change your plan moving to COBRA. It's really just a continuation. So if you're on a copay plan prior to leaving employment, you would continue that COBRA coverage on the copay plan until there was a secondary event to change or open enrollment to change the COBRA coverage. It's not a qualifying event to then go, well, I don't want the copay plan anymore. I'd like to switch to the high deductible plan for my COBRA continuation. That's not possible, unfortunately. So it's continuation of the same plan that they had, not an opportunity to change benefits. Retroactivity for the COBRA part, just because there's so many moving pieces and premium collections, we do have extensive COBRA timeframes that we allow for enrollment in a COBRA election. So generally retroactivity is 120 calendar days. So we want to get all those requests in within that period. Ideally, we use the golden rule of 30 days or as soon as you know about it to submit activity changes, benefit changes, or cancellations. But generally speaking, we do have 120 calendar days to submit where there's no additional retroactive review process required. For COBRA, that we extend that a little bit just because of all the moving pieces. And that's 179 days for a subscriber related event and 239 days for a dependent event. And with the pandemic, there's some additional rules with the Department of Labor as far as timeframes that are allowed and carving out the pandemic timeframe from eligibility. So it's really important to work with your plan and COBRA administrators to determine eligibility there and to continue coverage. But we do have extensive timeframes for COBRA election beyond the 120 calendar days. And Medicare, this slide is just a quick overview of what Part A, B, and C and D of the Medicare program are. We can advance to the next slide. That will be included in the slide deck when it's sent out. But
Eric, can I just interrupt? This is Elin.
Yep.
I just want to, as you went past the Medicare slide, just to let everyone know that always ends up being a confusing process when you have employees turn 65, when and if they add Medicare and things like that. So I do just want to say, if you have someone who's age 65 or their significant other is age 65, please call. We'll walk over this. We'll go through it together. We'll probably pull Excelis in, but the combination of Medicare and the consortium as primary is often confusing. So don't hesitate to call on this one. I have to go through it every single time and kind of walk through the process. So please be aware that there is a combination when someone turns age 65, and we'll go through it together when that time rolls around. Thanks, Eric.
yeah, definitely. We can pause here too, because I didn't want to skip this slide. The first one was just kind of Part A and Part B, but this slide here really, we mentioned the age off notices for dependents, reaching that 26th birthday. We also send age off notices for those reaching their 65th birthday, because we know there's some additional steps in education that needs to happen there. It's all new, right? So turning age 65 and working, joining the consortium does make the group size over 20, regardless of how many employees are actually at your group. So that's where the working age rules would apply for 20 or more. So the example that we have listed here, if someone's actively working still and they reach that age 65, Medicare would pay secondary. But once that employee retires, Medicare would switch to primary. So Medicare primacy is really based on a couple of factors. The group size, which in this case is over 20, and then the working status is a key component of that as well. So working beyond the age of 65 versus a retired employee, the Medicare primacy is different as far as who pays first and who pays second. So our group administrator guide will have some additional detail too, but we do send out those notices reaching the 65th birthday just because there's so many moving pieces. We don't, the Medicare premiums change, and that's where the Social Security Administration can really help. And we have phone numbers available to call as far as, if this, then that, and to help our members really work through and understanding, what's a Part B penalty, claims reduction, how is my premium going to be different, and things of that nature. So we do have the government resources and phone numbers to call for those individuals who need some help in weighing, HSA eligibility and electing Medicare or delaying Medicare. So there's a lot of moving pieces and components there, and it's pretty complicated. So we do want to try to get ahead of that. And we send out those group summary notices 60 days prior to at least 60 days prior to the 65th birthday. So that letter and group summary will generate. And then on our website, we also have the group maintenance guide. So here on the employer homepage, it's just a screenshot of our employer website. And then under the resources tab below the search magnifying glass, if you click on resources, there'll be a group maintenance guide there. We're in the process of updating that for this coming open enrollment. So it's going through all the final phases of our internal department reviews before it's published. And once we have that, we'll link it to our website, and we'll also share a version with the team here, and we'll update it to the healthconsortium.net website as well. So you'll have the latest guide with all the information, and the page numbers will likely get updated. So I didn't put page numbers in the slides here, but it's really a great resource just to have, and paper copies can also be sent once the new document is finalized too, so you can have that on your desk for reference and review as well.
So we do have on the consortium website new one on the website. And I'm sorry, my internet is unstable. Can you hear me now?
Yes.
It must be the rain. Sorry about that. So on the website is the entire administrative guide. And as Eric said, you can also get it in hard copy. If you would like it in hard copy, let me know. We'd be happy to mail one to you. Otherwise, it's always there available to you. And it's a great resource to check with. It has more information than you probably will ever want or need. But the good news is it's all pretty much there. So let us know if you want a hard copy.
Yeah, the hard copies are nice. My favorite thing with downloading it off the website is it's a PDF, so you can Control F and you can search for key terms in there, and it just pops you right to the pages. As opposed to flipping, but there's definitely benefits to maintaining a physical copy. You can mark it up in notes, or if you have questions, we can always update it or things like that. But I do like the search feature in a PDF just because it helps pop you to the pages. And this website here, on our website, we also have a form section. So if you need a adult disabled dependent form to send it to medical review to continue past age 26, or any other certification forms, those are also available on our website for download too. This is just an example of the adult disabled dependent form, and we updated it for transparency that we do need to apply within coverage within 31 days of the dependent aging off the policy. So this is a revamped form this past year. This is a certification form. If you do receive any court ordered or county agency ordered mandates to cover dependents, we look to you as the plan administrators to advise us if that's qualified or not. And all we really require is this certification form here, which is available on our website as well. So if you have any questions about that, it can be complicated and might require a little bit of research. And if someone's court ordered and you need to disenroll them, there's also a form for that as well, for us to take direction from you, the plan administrator. And these are just screenshots of those forms on our website. So with that, that's really everything that I had. If there's any questions or scenarios, feel free to let me know, or we can do it in the chat and get responses at a later date.
All right. We haven't heard from anybody in a while. I just want to make sure you're all still out there.
Still here.
Still here, Diane Seidel.
Great. And those of you without mics, feel free to give us a thumbs up or something, just to make sure we're all still connected. So we're going to move into our last section, something that we do take a lot of time and care to discuss at the consortium is wellness and healthy lifestyle programs. The Joint Committee on Plan Structure and Design is now home to that committee. And that's where wellness topics are cussed and discussed. Usually monthly, the consortium will send out to you a flyer to share with your employees. Most municipalities have someone who's their wellness champion that distributes those flyers and or incorporates it into your own wellness program. We're going to hear soon from Excelis about several resources they have available to you as part of the Excelis family, but also know that the consortium will continue to push out not just Excelis and ProAct healthy behavior information, but additional information as well. So, and I see that Owego and Tioga are still here. So thanks for confirming that. So just want to, let you know, you will see a lot more on wellness, and usually Jason is behind the scenes. Deborah will be the one sending that information out to you. And we just are trying to gain momentum on encouraging our employees to have healthy lifestyles, healthy behaviors, to keep claims costs down and to improve better overall health. And I just want you to know, my IT director, also known as my husband, told me there's nothing wrong with my internet. It must just be me. But I'm sorry for cutting in and out. And I'll try to make sure I have full connection for the rest of the meeting. So with that said, I think we're turning it back over to Beth and or Jason.
Thank you, Elin. That would be Jason Warshaw, our wellness consultant, works closely with the consortium and Own Your Own Health committee meeting, which is part of the joint subcommittee plan and design meeting. So we really pride ourselves on working closely with the municipalities to engage the members. The whole premise of the consortium is the fact that we're able to offer excellent benefits at a lower cost. So in order to do that, we need to keep our members healthy. So that's where Jason comes in sharing some of the wellness tools, tips that are available to members. With that, I'll turn it over.
Hi, everyone. This is Jason Warshaw. It's a pleasure to meet all of you virtually. And like Beth and Elin have both conveyed, I think there's some great opportunity to help you in assisting, members within your municipalities on where to find these well-being, wellness pieces. And in saying that, you'll see that as you join, we have been more strategic in launching some of these well-being initiatives and really trying to provide the best way to access health and wellness pieces associated with the Excelis health insurance, as well as, kind of navigating our systems and seeing what partners we have out there in the community. So it's been great to collaborate with the consortium. And hopefully what you'll see in our slides is something that would be relevant and easy places to access these. So I don't know if we have the slide deck up.
I don't see that.
Slides.
I do have them. Yeah, I can pull them up if you want, if that's easier. I just thought they were.
No, I was asking Deborah. Deborah should have
okay.
them. They were next on the PowerPoint. There you go.
There it is. So if you want, awesome. Well, actually, yep, we'll go right in. So part of our thinking in working with owning your own health is to think of the concepts of something similar to 6 essential elements of well-being. So thinking of your employees, their career well-being, making a sense of a purpose of coming to work every day, making it enjoyable, making, these pieces that we'll see in this deck and what's actually already been discussed more accessible, more self-serving, if you will. Social well-being, understanding, as we have, some of us have been in a virtual space for some time, what's that relationship like? What's going on at home? Understanding, your day-to-day life. Community well-being, the communities that you live in, the bonds that you have, those things are incredibly important, and how you're engaging with others, with your peers, etc. And then the physical piece. So obviously having a doctor is a critical component to being healthy, living a healthier lifestyle day to day. So, understanding where to navigate those things and how to navigate the health system itself. To the financial pieces, right? So, what's your economic status right now? What is it going to be in 3 months? I mean, everything really has been up in the air. So taking that piece into consideration is something that we want you to take in and keep in mind. The emotional well-being, I think, mental health is a big piece of what we are all experiencing day to day, based on current situations, whether it be at work or your home life, and those things. So using the 6 essential pieces here really has been a foundation of what we are trying to build and provide to any Excelis member, and for that matter, any employee of the consortium. Next slide, please. And with that, thinking of the lady in the middle there, right? So she's an employee at one of the municipalities. Excelis has tried to kind of wrap everything around her and make them more accessible. So what we'll do is I'm just going to cover each one of these spokes, right? So it's critical for you as an Excelis member, as an employee, to know where to begin. And I think it's been mentioned a couple different times, but we want that member to be able to access Excelis's website and mobile app, right? So they're a critical piece of starting to better understand your health insurance and healthcare as a whole. So again, how do we help members understand how to register for those things? And you'll see at the end of my discussion, there is a quick tutorial that I'll go through and show you where to begin and help navigate members too. Benefits, so understanding what you have currently under your Excelis Health Plan benefits, what your costs are going to be, maybe, in some instances, if it's a high deductible health plan, where your copays are, what, if you're meeting your spending, tracking your spending, understanding your claims, where to find those things. So again, we'll show you more in depth of where to find those. Care management. So if you want to go back quick. There you go. It goes fast. So care management is a piece that is something, that any Excelis member has access to, speaking with our care specialists, whether it be physical therapy, behavioral health specialists, in conjunction in tandem with your healthcare providers. You have access to our team to help answer any questions, understand and manage certain types of conditions, chronic conditions, nutrition, and various other pieces. So it is available to a member, and we want to show that member how to use them and have that as a value resource down the road. Estimating medical costs is, again, a critical piece, right? So you're looking at, you've met with your primary care physician, and you have potentially a surgery coming up. you can estimate and find what that potentially is going to cost you, your family, thinking of some of the financial pieces, right? So you can track your healthcare spending and really shop around and be, that advocate for your health and your health care. Member card, again, it seems like this is one of the critical pieces that we should all know where our insurance card is, where it exists, how to find it, our number. It has critical pieces of information on everything from co-pays to, like I said, the care management number on the back, your subscriber ID card and number is a valuable piece of information to access what you see here. As PROACT did cover that as well. It's a big piece of our health insurance. Prescriptions and mail order. I'll defer most of this commentary to the PROACT folks. It was a great presentation earlier. Keeping in mind, part of our health is taking our medications when appropriately. So we do have some additional pieces there in conjunction with the PROACT team. Health and wellness. I'll share with you as we move through the rest of the deck some pieces that you can have members access and as benefit clerks help navigate them to down the road, as we finish today's discussion. So I'll show you where those exist. Critical to all of this, certainly finding a doctor is and plays an important role in your everyday health, making sure that you are going to the doctor, especially in the pandemic piece that we are all experiencing live right now. It is imperative that you have a doctor, so we'll share with you how to navigate where maybe some of your members do not, or they haven't gone to the doctor in a while, where to find that as a valuable resource. And we'll actually cover, in line with the provider piece, telemedicine and increasing your access to provider networks that are out there through Excellus. So everything kind of wrapped around that member, that Excellus person in the middle. So if you want to go to the next slide, please. So and most importantly, like we said, and you'll hear it a bunch of times, even after we finish today, but your member account online, the mobile app, are critical pieces. So you can see I've covered what you can obtain once you have a login, and I'll share with you where to begin. The slide deck itself does have some hyperlinks in here that you should be able to access after we finish today. For example, there's a video tour of where to find a local or a national provider that's participating with the Excellus plan, the plan that the consortium is in. And results are personalized to you and what you currently have once you have obtained a login. The login for the mobile app is the same as it is for the website. So the same user ID, the same password. So I'm sure most of us have a smartphone or a tablet, but if you download the Excellus app, you can have everything right at your fingertips. You can actually pull up your subscriber ID card, etc. The telemedicine piece, like I said, it is, and we'll cover it a little bit more in detail. There's a video tour that's here. Again, clicking that link, and I'll share with you at the end in my tutorial. And finally, WellFrame. So here is where another partner app, again, having these things dialed in, showing members where to find them, how to register is a critical piece. And hopefully, we can share with you how to navigate those resources. WellFrame itself is a way to interact with our care management team. You can, get certain medical answers, different types of conditions that you are facing, your family is facing, dependents are facing. There is also a testimonial video. And what we wanted to do really is make it accessible for you guys, for all the clerks. And then, how does that trickle down to the members? We're here to help, Beth, our team, Elin. We want to be that resource for you going forward. Next slide, please. So again, I'll say it one more time, the mobile app, you have right now, you have those 7 things that you can pull up on your phone or on the website and track everything, right? You can self-serve your account. You can find a doctor or a dentist. You can track your claims, see what your coverage is going to be, find out what you're spending your money on. in some instances, what rewards are existing out there, as well as the treatment cost calculator.
Okay,
And then
Jason,
if you want to go to, yep.
This is where I usually jump in and let everybody know, because we have Excelis and Proact working together. Please note that if you're on the Excelis website and you're looking up your deductible or out-of-pocket maximum, it's only Excelis information on that graphic. And if you go to Proact, you're only going to see your Proact claims. So if you're trying to figure out how much money you spent total, there is a way to find out through Excelis, but it's usually by calling the customer service center. The Proact information is not integrated on the Excelis website. So that's just a reminder for the future. If you say, hey, I already hit my deductible, how come it's only showing 3/4 of my deductible on Excelis? That would be because any of the prescriptions you filled. So just a little reminder on that.
Great, thank you, Elin. Anything further, or should I proceed?
Please proceed.
All right. So telemedicine, right? And you know, as we have evolved over the past several months, we have seen more use, more registration in our telemedicine program, and I'll explain a little bit about it. But we have partnered with MD Live to provide telemedicine services. In this case, they are available to members once registered 24/7, 365 days a year. It is an on-demand access via your smartphone or telephone virtual visit anytime, anywhere throughout the entire United States. It is an extension and an increase in access to your provider connectivity. But in this case, doctors can diagnose your symptoms, and we think of this often as, you know, acute types of illness, so illness that we not necessarily would want to go to the emergency room for, but rather being able to have a virtual visit in the comfort of your home or maybe office or wherever you are. In this case, MD Live is available to prescribe medication when it is appropriate. So, you know, you're sick on Saturday evening, you know, you could have a virtual visit and have treatment, you know, by the next day if that's applicable based on the condition that you are having. You can provide your pharmacy, or maybe let's say if we ever have the chance to travel again, or you do if you go out of state, you can access the MD Live telemedicine provider network in this case. Next slide, please. And registering is a critical function, just like the Excelis mobile app. There are couple different ways to register for MD Live. So here you can actually call the 866 number. You can actually have Sophie, so the text Sophie chatbot, as she is called. You text the word Excelis to 635-483, and Sophie will provide you with prompts to help register and guide you through that process. You can go right to your Android or iPhone and go to their store and download the MD Live app. It's the orange colored application that you see there. You can actually begin at Excelis's website and transition over to mdlive.com to register. And it's a relatively easy process. We do have some collateral and pieces that we have promoted. This has been one of our strategies to, especially during the pandemic, to provide more access to more providers in this case. In conjunction with it, we do also really want to make sure that if you have a doctor, if you have a local physician, you know, to maintain the relationship that you have with that physician and ask, right? So it doesn't hurt to ask to see if they can provide care via telehealth, telemedicine. So check with your primary care provider. Next slide, please. there we go. Accessible to all the clerks, you have ready to go is a telemedicine toolkit. So if it's something that you were interested in promoting, and you'll see as well in some of our discussions with our monthly promotion, right? So we've been working closely with Deborah and team to provide a more strategic inline piece or health kind of content for each month. In some instances, we have run out the telemedicine toolkit, but if anybody has a question on it, you can certainly have this ready to go. There's quick link videos, so if you have an opportunity to post it, you can add that hyperlink to the site that you use. You can actually pull it right from excelisforbusiness.com. There's ready to send emails, there's posters, and maybe some of you have registered, maybe some of you have promoted it. If not, we are here as a resource to help promote it. So maybe I'll ask the audience, and you can just populate in the chat function on the side. Have you tried or registered for MD Live? Have you used MD Live? Or maybe have you had a telehealth visit with your provider? A couple quick yeses or nos or unsure would be awesome to see in the chat function. And while that's happening, we'll go to the next piece. So as I mentioned in that spoke, member care management, you have access, to work with our dedicated team, our coordinated care, right? So you're working with your doctor, maybe you have specialists, right? And you have questions. Our registered nurse works with a team of our healthcare professionals to really, give you one-on-one support to meet your health goals as you proceed through a certain type of treatment or manage the condition that you are experiencing. Like I said, chronic disease, is something that's there. So ultimately, how do you prevent certain chronic disease? It's talking with your doctor, but if in the event that an employee does have a chronic condition, through our member care management team, we can help guide that person through it. So understanding what barriers might be existing from, going to and having, your health goals and overcome them is something that we want to do. We want to identify them and see how we can overcome them when necessary. So if it's education on pieces of maybe it's diabetes, what tests should you be having? Maybe you have a family history of certain conditions. Certainly we want to help guide you through it. Number 3, again, so complex conditions that have multiple areas of where a member really needs to, connect with a certain specialty within the member care management team. Behavioral health, right? So a lot of our stress, anxiety, chronic conditions stem from behaviors that, stress is really kind of adding up over time. Maybe it is something like substance abuse or mental health. These are resources that we can provide to consortium members and really help start to treat them. So again, you do have access to registered nurses, dietitians, behavioral health specialists, social workers, and the access of connecting with them is available there. Again, we have various pieces of collateral, stuff that you can populate via intranet, etc. So you have the 2 numbers that are available for member care management and then the behavioral health management, and you can see the dates and times that they are open and available for use. Next slide, please. So again, in conjunction with our care management team, you have another app. It's our WellFrame partner. It's right on your smartphone. It will help connect you with our care management team. So, in the virtual space, we are able to have that right there at your fingertips. So at some point, maybe it is an option to try this piece out, right? So if you can learn how to use it, you can spread how that goes to your team and to everybody within your municipality or area that you are currently in. So again, there's medication reminders that are on here, so making sure you take your medications when appropriate. There are opportunities to get answers to everyday clinical questions. Again, wrapping everything around that physical piece for the member. If support groups are your thing, there's opportunities to access them via WellFrame. Managed condition, like I have talked about, understanding a certain diagnosis that you may have had recently, and then health-related articles and videos. So all you have to do is download the WellFrame app, and the access code itself is Excelis. And we'll move on to the next slide, please. So Blue 365, again, we'll cover this in the tutorial when I finish the slide deck. Here you have access to hand-picked deals. There's various discount pieces that are offered through Blue 365. This is free. There's no additional cost to you. You do have to register for this one as well, but it is available to the consortium. And if we want to go to the next slide. And as we move into the beginning stages of our holiday season, our work with Elin and Deborah and the consortium in Owning Your Own Health, we are going to be kicking off a Maintain, Don't Gain platform. In this case, it's a weight management program, so it will run through the holiday season, typically 6 to 8 weeks. Actually, I just sent everything over to Deborah yesterday. Actually, I'm sorry, this morning. But we'll be looking at providing this as not really a contest, but a competition to encourage employees within the consortium to think about healthier lifestyles. Look at how weight impacts health, how it all can lead to various health conditions down the road. So this will be a fun activity that we'll soon be launching with the consortium. The Maintain Don't Gain program was developed by the Texas Department of State Health Services Cardiovascular Health and Wellness Program. It's a community and worksite wellness program, and it's available in its original form there, but we at Excelis have used that as a platform, and we've modified it a little bit. But really that program will be kicking off very soon. So I look forward to working with you and with everybody that is joining this. So, and we'll go to the next slide, please. So with that, I don't know if there are any questions. If you want to populate them into the chat function, you certainly can do that. While that is occurring, I am going to steal the share function if I can. And I'm going to walk you through the Excelis app and website and really show you where some of these things are, how to navigate to them.
And just for everybody on the call, to let you know that we remind you there's so many features and so many benefits of having these wonderful organizations be affiliated with, or that we are able to be affiliated with these wonderful organizations through the consortium. There's a ton of information on the Excelis website. Corey showed us information on the ProAct website, and we tend to forget those resources are there. So part of the wellness program is to remind you about WellFrame and MD Live and telemedicine and things like that. It looks like no one has used MD Live, but I know that we are being moved due to the pandemic more into the whole telehealth and telemedicine. So I think we'll be seeing more use on that going forward. Okay, Jason, I don't see any
Perfect.
questions coming through, so just be mindful of time, please.
Yeah, absolutely. So I'll take you home, and I won't keep you from eating lunch, but at this point, here's the main screen. So let's say you are not registered. You would begin at home. I have, for the sake of time, I already have my member information and password ready to go. But before I do that, I'm hovering over the coronavirus COVID-19 information page. So as Beth mentioned earlier on in our beginning, here is where you can access everything from, staying informed about with, through the Excelis piece or through the CDC, New York State. There are critical pieces of information there. So with that, I'm going to log in. And please be mindful that this is my login, but there's no other way to show you how to navigate through these. So once there we go. So it's loading. It does take just a couple of seconds. So right up front, right? So once you have registered, this is what you would see for your home page. I'll briefly go down. I'm going to buzz through my piece, but I wanted to share with you what your in-network coverage is. So this is going to maybe look a little bit different based on what you have, but it's going to show you upfront what your costs are going to be associated with different types of visits. So Office PCP, it would have listed, again, according to what you have for your health insurance, what you're going to pay, what your copay would be, if you have a copay plan. And I'll just buzz through the bar. I think it's a good representation of informing you of what a visit is going to look like, what is going to be your spending, what's your financial piece of everything, all the way through, therapy, inpatient hospital services, what my copay would be, imaging or radiology, advanced imaging, et cetera. So as that is the one thing I wanted to show you on the main page. Again, it's got everything up front. If you have a high deductible health plan, it would show, what your copays currently are, what your spending is, and maybe or not you have met your deductible. My account, in this case, you can go to each specific section. So you have your benefits, view your member ID cards. You can search authorizations if you're awaiting a certain procedure and its authorization. This is where you can search. Typical account pieces, change your address, view statements. Maybe you want to go paperless. That is down here at the bottom. You can change your password, as I like to do frequently with my accounts. So that's your kind of overall overview of my account claims. So you can search, submit for claims. I'm not going to go down and show you what we're going through as a family, but certainly this is where you would submit and search for past ones. Maybe you want to get a better understanding why you're paying what you're paying for, and you can do that here. Prescriptions, again, I'll defer to ProAct, but there are some informational pieces that are there. Find a doctor, so that spoke, right? So here is where somebody that may not have or be attributed to a family care provider can find a doctor, can find a dentist. You can begin a telemedicine or search for telemedicine services, cancer treatment centers, compare hospital quality. And another spoke here is estimating medical costs. You can search for those appropriate. Health and wellness tab. So this is the kind of piece where I like to shine on what you have or may have access to. Again, it may look a little bit different, based on your health insurance, but I wanted to specifically click on Blue 365. So Blue 365 members can sign up. Again, it's free. You can check, really save money if you want. There's all sorts of discounts. There's weekly deals. I continue to get my email. You do transition over to another secondary site. So it's blue365deals.com. And you do have to register here, of which is up at the very top portion of the web page. So where it says sign in or join. So again, this is recommended for members to sign up and begin taking advantage of health and wellness. And I'll share with you just quickly. So all sorts of categories. You have everything from apparel, footwear, discounts, to fitness gear, like your Fitbits. Typically, at times they'll run promotions on discounts for those wearable devices that we might like, may not like, but may want to try. There are discounts on hearing and vision, home and family nutrition, personal care, travel. And this week's current deal, so you can see Sonicare toothbrush, so oral hygiene is something, we want people to continue with, whether or not you have gone to the dentist in a while, but, here's a way to access certain discounts on those things. Again, all leading to well-being. There's nutrition, there's personal care. So these are the current deals that are found on Blue 365. So I'm going to go back to the main page. Again, Quicken is pretty easy. I think there's ways to help navigate. Preventative health, there are all sorts of healthcare topics that we want members to access, understanding your numbers, what your cholesterol levels might be, your A1C. So, maybe you have elevated levels of those and you want to know more. Here is kind of a one-stop shop to understand and become more informed with health decisions. So health tools, there's cholesterol, colorectal cancer screening. So you can see the various topics here. There's all sorts of learning modules that are there. And with that, I'm going to just go over quickly managing conditions. So here's where you would access the care management team and WellFrame, as we spoke about earlier. We do have information on advanced care planning. So living will, a medical healthcare proxy are all available at your fingertips. So that was kind of a super quick run through. One plug that I'll make and then I'll finish. We actually have a Making the Most of Your Health plan. They are live, they are monthly. Our next session for October will be held next week. They are, again, anybody can join them. It's live. You'll hear how to navigate these resources. So if that's something you wanted to push out to the staff within your department or office or building, that is available to you. We actually have it recorded, so we could provide a recorded link. So maybe that's more appropriate for staff to access those features. So with that, I will finish my quick tutorial and I'll turn it back over to Elin. If you have any questions, please feel free to connect with the Excelis team, with Elin or Beth and myself or Terry. But I want to thank you all for the time and hopefully this is useful.
Great. Thank you, Jason and the Excelis team. So as I see, we are coming up on the lunch hour. We have kept you for a long period of time this morning and thrown a lot of information at you. I hope it was absorbing your start date.
And you're going in and out again.
I'm sorry, I can't control my internet, so we'll get through the rest. Sorry about that. But with that, see if there's any questions from you. At least today was an introduction. You know who the important players are. And I want to thank the Excelis team, the PROACT team, the Losi and Cahill team, as well as the consortium. And then all of you new members for putting your faith in the consortium and more importantly, the healthcare of your employees. Don't hesitate to follow up with any questions. We'll be talking to you soon. And we'll get through the holiday season and the rest of the pandemic together. So thanks for this morning. And I look forward to meeting you all in person soon, for those of you who I haven't. And if not, continuing our relationship through Zoom.
Thank you.
All right.
Thank you. Bye-bye.
Thank you.
Everyone have a nice day. Bye-bye.
Thank you.